Hello and welcome to Phoenix Behavioral Health Therapy Chat. I'm Dr. Dawn Parks and this is Christine Delorier.
Hello.
And today we're going to talk about Alzheimer's. I think there's a lot of confusion between dementia and Alzheimer's. Some people will use it kind of interchangeably. So just to start, we can look at that difference. We're looking at dementia as almost like an umbrella term, right? Mm-hmm. So the dementia itself means that there is a progressive decrease in cognitive functioning. So ability to think clearly, short-term memory, planning, decision making, orientation, where am I, what am I doing, who is this, what's going on. So that's like the umbrella term, and there are a lot of different reasons that a person may exhibit dementia. But 60 to 80% of the time, the cause is Alzheimer's. So today we're going to just focus in particularly on Alzheimer's and what that is. So some of the causes that I mentioned earlier could be metabolic reasons. It could be stroke. It could be drugs. Outcome of a lot of alcohol use. So typically when a person presents with memory issues, often they'll come in and be very worried that they may have Alzheimer's. They say, I'm forgetting a lot of things and sometimes a little bit disoriented, stuff like that. And so we have to make a distinction between what is normal age-related memory loss and then something more serious, like, for example, Alzheimer's disease. So it's something that takes a little bit of time to diagnose, and it's not something that a person can come in and say, well, I think I have that, and yeah, you do, no, you don't. There's medical tests that are going to be done. There's testing that's going to be done where memory's tested and certain criteria have to be met. And so it takes time. So we're looking at the progressive cognitive decline of an individual over time, and typically it's arranged in or defined in 7 stages. And stage 1 and 2 may be very imperceptible changes. When we look at stage 3, you're looking at family members maybe noticing some fairly obvious differences, changes. So we're going to, in a few minutes, put up some of the overheads that look at the difference between mild, moderate, and severe, which would be stage 6 or 7 of Alzheimer's.
I have had a lot of clients come in, as you mentioned, talking about not remembering things, forgetting things, and being concerned and anxious that they had dementia or the beginnings of dementia. And one of the things that I find that is a huge factor that can sort of send up a false flag sometimes is stress and anxiety. A lot of our clients that come in are usually coming in because they're under great stress. There's something, crisis happening that's bringing them in. And when you are very stressed, you tend to get very distracted. And it's very easy to forget things that you never had forgotten before. And so then that becomes alarming to you, and you think now you've got dementia on top of everything else, when really it's the level of stress. And that is also linked to with people who do have dementia, because they can sort of sometimes kind of float along at this kind of early stage level where you think maybe there's something going on, but you're not completely sure, and they seem to sort of recover from some missteps that you might notice, but then there's a stressful event, and when they escalate stress around them, they become highly confused, and you can see the definite difference, and you can see, oh wow, they wouldn't have acted like this normally, and there's something going on here. So so stress is definitely a factor, and I always recommend to people that they see a neurologist for a real medical diagnosis, because you're not going to be able to define it completely just from a therapy perspective.
No. And what you just said, the anxiety, you say to clients, as anxiety goes up, so does memory issues. You see more and more memory issues. And sometimes the issue is, capturing information in the first place. As that discussion that we just had, or that event that just happened, was it even taken into memory in the first place? And if I'm not focused, if I'm not concentrating because I have anxiety or stress, I'm not even able to capture it. So I come away thinking, I don't remember what that movie was about, or what I had for dinner yesterday. And it makes sense that a person can be very upset about that. So really the first point is, like you said, explaining and looking at what's happening in my life right now. Is there more stress? Is there more anxiety? And explaining what happens with that. And then going to see a neurologist, making sure that medically the person is okay. So it's a process. So typically we see memory issues with Alzheimer's, a lot of memory issues. We see visual spatial disorientation, don't know where I am, I suddenly don't recognize a place. Ability for planning, ability for just basic judgmental procedures. So there's a lot of cognitive impairment. And when we look at age of onset, defined as late onset would be 60s and older, but early onset could be as early as 30. So there's a fairly big range,
I think too, there's also a lot of people, especially as they get older, there's memory loss due to vascular dementia, which is due to many strokes that they may have, that they're not even aware that they've had, and the family's not aware that they've had them, and that's a little bit, it's under the umbrella of the Alzheimer's, but it's a little bit different, and that is, I'm seeing that actually quite a bit in my clients, and in personal life with friends and things, that seems to be, it's getting fairly prevalent, that there's this vascular condition that people are dealing with, and with all of these, long-term memory is often perfect, it's intact,
exactly,
and it's the short-term memory that is affected greatly, and so sometimes people will also do what we call confabulation, which is making up a story to cover up what they don't remember. So you think that you see something that is off, and you question them on it, and they make up a pretty good, convincing lie, and then you begin to sort of either believe them or question yourself, and it takes usually several instances of that for you to realize, wait a minute, this isn't quite right. And often you see that too with alcohol-related dementia. Let's look at
the first graphic that talks about the symptoms of mild Alzheimer's disease. So where we can see, number one, memory loss, poor judgment leading to bad decisions. Also, and this would be considered early stage, you see kind of a loss of spontaneity. There's not so much a sense of initiative that's there. It's almost like a lack of motivation. And also taking longer to complete, daily tasks. Things that would normally take 10 minutes may take 40 minutes. So it's kind of struggling through that, and this is where people who are close to the individual will start to see too. Not always will the individual notice these early signs as much as the people who are close to them, and they say, I've really noticed this difference there. Repeating questions. Trouble handling money, paying bills, doing the things that they normally would do. Wandering, getting lost, losing or misplacing things. And everyone forgets where they, you walk into a room and you're there, why did I come in here? Where did I put this? But it becomes noticeable. It's much more common. There's also mood, personality changes, a little bit of mood swings, and typically either there's an increase in anxiety, or there could be also an increase in aggression. So someone who is normally not like that at all could suddenly kind of get very snappy and aggressive. And typically at this stage is when there's more, the diagnosis would be able to be made. It's a mild, early stage 1 or 2 of Alzheimer's. So the next graphic, signs of moderate Alzheimer's. And in this stage, this is when we will need to look at perhaps a little bit more care than is currently available or provided. There's an increase in memory loss, and also seeing confusion, a little bit more confusion. And it's very difficult to learn new things. You'll see difficulty with writing, basic problem solving, numbers, basic calculations, and that's why one of the interventions that we want to see is with testing with a psychologist who can look at, can run a battery of tests, and especially look at different types of memory tests, things like that, where a person can have a much better idea of what's going on. Attention span is reduced. A person may, when they're talking, not quite make sense sometimes, like it's kind of disorganized. Mm-hmm. Instead of going 1 through 10, it might be 1, 5, 2, 7, and jumping around a little bit. And difficulty in completing tasks that may consist of multiple steps. It might be even something like getting dressed. Mm-hmm. Picking out the clothes and getting dressed might be an issue. Problems identifying friends or even family members. And at this stage, we may also see hallucinations, paranoia, mm-hmm. and delusions. And the process is a little different for each person, but just to define hallucinations, seeing things, or through any of the senses, feeling things, hearing things that are typically that are not there. So a person may, see something or feel that there's something on their skin.
Sometimes they think somebody has come and visited them, which
Yeah.
hasn't happened. Or
Yeah.
they think someone has come in and stolen something when instead they've misplaced it, or maybe it's not even moved at all, but they
Yeah.
think somebody moved it on them.
Yeah.
And I think also you can see around this stage they will get lost if they're out, like if they're out driving or walking. Often they could get confused and get lost on how to get back home.
Yeah. And delusions, meaning beliefs about things that aren't quite possible. It may be like a 1 in a million likelihood that they are, but so there's a change in beliefs about themselves or about other people, and paranoid thinking might be there. Like you said, someone stole something or someone's planning something. There's also we're going to see a little bit more impulsive behaviors. So there's impulsivity, and it might just be suddenly undressing, maybe just suddenly doing something that's completely unexpected, or swearing, coming out with language, and then normally they wouldn't do that. Also, kind of an outburst of anger.
Some hoarding behavior sometimes. And forgetting to eat, which becomes a real concern with the elderly. Even if meals are delivered, if you're not sitting with them and supervising it, they will often not eat the meal and then swear to you that they've eaten when they haven't, and then you'll find the food later.
And we may also see an increase in anxiety or crying. Just crying spells, feeling very sad and tearful, and usually it happens late afternoon or early evening, where you see an increase in agitation and restlessness in the individual. It can be repetitive movements. It can be repetitive statements. I'm saying something and I'm kind of stuck and I keep saying the same thing over and over again. And you may also see in some people muscle twitches as well. So those were the stages of moderate Alzheimer's, and then severe Alzheimer's, graphic 3. Really communication is, basically non-existent, and a person is really fully dependent on care from people around them. You really need like 24-hour care. The system is basically shutting down, and there is that inability to communicate. See weight loss. A person may have seizures, skin infections.
There's usually an aversion to showering and bathing during moderate to severe stages, so that's another problem when taking care of people, especially the elderly.
There may be difficulty swallowing.
Yes, that can be a late stage problem. Yes, that can cause, and you have to be careful with that, because that can lead to aspiration pneumonia, which is very serious and often very deadly.
Common cause of death. And the person may be doing a lot of kind of vocalizing, groaning, moaning, making sounds. May see increased sleep. And we may also see incontinence, bowel or bladder, loss of bowel or bladder control. So, quite a few things. So, there's still a lot of research, a ton of research in this area. So there's not really a cure, but there are medications that can treat the symptoms of the disease.
None of them are that effective, though, unfortunately.
No.
So,
No.
you know, if people look to the medicines to be the answer, they're probably not going to have that happen.
No. No. But, you know, it may be, you know, if you're talking about, like, for example, really high anxiety, there may be something that
can calm the agitation a little bit. Yeah.
And I think really, you know, having those support systems, but it can be so hard for the family as well. So having some kind of mental health support also for the family who are going through this, you know, not being recognized by that person, you know, so that can create a lot of anxiety and stress for family members and close friends as well. You know? So I think, you know, having or trying to find a really good system that's going to take care of, from a medical side, from a mental health side, and also from a social support system side, you know, finding support groups for the individual and for the family can be very helpful too. And some of the Alzheimer's foundations and can be really good resources.
Right. Yeah, so you need a lot of support, and there's unfortunately not a lot of help when it comes to placement, and even home services. You know, you basically have to hire home health aides, which sometimes are wonderful and sometimes they're not, and that's a stress. And then finding a placement, and that's often not covered by insurance, and you have to pay out of pocket, and they're several $1,000s a month. So it's a tough situation to be in for family members.
Yeah, and it can be a relatively long process. So, yeah. So, I think that's about it for today, for this session. So thank you for joining us with Phoenix Behavioral Health. And if you have any questions about what we discussed today, or if you have any thoughts about anything that you would like to see us discuss, you can contact us at 508-623-3931 or at phoenixinfo.online. Thank you. Take care.